Wake up! It's the Sleep Unplugged podcast with Dr. Chris Winter. This is episode 29, Snoring, the sound that drives us out of our heads. Welcome, everyone, to the second episode of 2023. Very, very glad you could be with us. If you're new to the podcast, I'm extending a most sincere welcome to the Sleep Unplugged family. If you're a veteran, equally sincere thanks for your support. The support for the podcast has been overwhelming. I just can't get over the numbers of people that are tuning in. It's a real shock. And each episode keeps getting better and better, which means one thing: you all are talking about it, you're sharing it with friends, family, people who need good sleep help. And I really appreciate it. I sincerely appreciate it. And we're having a lot of fun doing it, a lot of fun interacting with the people on the show who listen to the show. Always appreciate your comments and questions. You can interact with the show at drchriwinter on Twitter, drchriwinter Instagram, drchriwinter TikTok. We have a Sleep Unplugged YouTube page where we keep video files of these shows posted. And you, again, searching for Sleep Unplugged on YouTube, we'll pull them all up if you prefer to watch the content. I am Chris Winter. I'm a neurologist and sleep specialist involved in sleep research or sleep treatment for about 30 years now. So really enjoy talking about sleep, sharing what I've picked up with you, and talking about topics that interest you. And we've got a list of them. So we will not be suffering for episodes in the future. So really appreciate follows, likes of the show. Subscribing to the show really helps us out a lot. And I appreciate the people who take the time to leave a kind review. And we talked about one a couple episodes back. Our good friend, the principal, left a very, very nice review, but accidentally tagged it 2 stars instead of 5 and was really upset about it. But she actually fixed it. She was able to go in there and change it to a 5-star review and eliminate the 2-star review. For a while, there were 2 reviews of the same. So I just want her to know, our good friend, the principal doctor, that I really appreciate that. Appreciate everybody's time that it would take to leave a review and let us know what you think about the show. So we usually start the show off with communications, questions, comments. No corrections that I've found, but I thought it'd be fun to return back quickly to the episode we did on temperature. This was episode 25. I had 2 interesting posts, one from Broomhilda. Broomhild. I hope I'm not pronouncing your name incorrectly. I think it's Broomhild. She said she recently bought an electric blanket for her bed. It just kind of goes over her feet, and found that it really helped her sleep very, very well. It turned itself off after 90 minutes. So she felt like it was safe and it wasn't, something that was going to be running really hot all night long. But she talked also about her 9-year-old liking to have a bag of warm grain or a cherry pit bag at his feet. So cherry pits, grains, certain peas in their dried form can be put into sort of like almost like a bean bag and heated up to provide warmth. Sometimes she said that her child uses a water bottle, but that might leak. The cherry pits don't leak. Appreciate that little bit of insight in terms of what you like to do. And then Fitbet1 said that she really likes a hot bath and then windows open to cool down the room. So that's sort of that classic Norwegian, get into the sauna and then right into the cold tub, which a lot of people think is very healthy for your body in general. So thank you very much to the both of you for communicating with the show. Again, if you want to communicate with the show, drchriwinter, TikTok, Instagram, and Twitter. We talked about the hats. Still have a few available. Sleep Unplugged hats, if you're interested, $25. Just DM me on one of those platforms and we'll get you one. We're going to come up with some sort of game to play with the hats. Like at the end of the year, the hat that's been photographed in the strangest place or the place furthest away gets gets a prize. We could put a prize package together. I'm struggling with the rules here just because I'm looking at where this podcast is being listened to, and it's literally all over the world. So I figured out that the spot furthest away from Charlottesville, Virginia, which was going to be the goal, the furthest away from Charlottesville the hat could be photographed would win the prize. But if you're somebody who lives in Augusta, Australia, you are actually living in the furthest habitable point from Charlottesville, Virginia. So that person could just buy a $25 hat, take a picture walking around Augusta, Australia, and get the prize package without really lifting a finger. So we'll come up with something a little bit better. My family member had the most interesting place sleeping, or, in a place where sleeping would happen, like on Thomas Jefferson's bed at Monticello, which I don't want anybody getting in trouble with the hat. So we'll come up with some rules because there's enough people buying the hat now that I think it could be kind of fun. So stay tuned for that. Today, the topic is snoring. And I think this is going to be a really fun topic and one that's extremely worthwhile and something that affects a lot of people. And I named it The Sound That Drives Us Out of Our Heads for a reason, because my favorite story about snoring involves the Rolling Stones, and specifically Keith Richards, their longtime guitarist. So when the Rolling Stones were recording their fourth studio album, it was their fourth American studio album, third British studio album. This was the album that would come to be called Out of Our Heads. And it featured their first number one song, I Can't Get No Satisfaction, which apparently came to Keith Richards at some point, the riff, with the famous riff that Rolling Stone says is the greatest hook of any song ever and the number two song ever released or something like that. It came to him, so he brought out his little tape recorder, recorded the riff, and it took just a couple minutes, dun, 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 I'm sorry, dun, dun 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 dun, whatever. So he comes up with that riff, or I Can't Get No Satisfaction, and promptly falls asleep. So the tape has a couple minutes of Keith playing the riff to I Can't Get No Satisfaction, and then an hour of him snoring. And I always just thought that was such a great story about snoring. So I thought that would be a good title for our podcast. So let's talk about snoring. It is not old. Snoring has been described for a very long time, particularly in Japanese literature. There was writings about snoring. I liked there's a paper that was written in the Royal Society of Medicine. This was a paper that, and I'll post it on the Twitter account, drchriwinter, dated November 7th, 1947, written by Ian G. Robin, who said, "This short paper is a plea for the more serious consideration of a complaint, which is often a distressing physical and mental handicap. It may ruin a happy marriage, and in some parts of the United States of America is considered justification for divorce. Up to date, it has been treated as a comic pastime, and the unfortunate adult sufferers, and even more the agonized relations and associates, have to bear with it in fear of ridicule." So I like the idea that this condition has been around for a while, and maybe more aptly put, has been discussed and thought about for a long period of time. And it is not rare. I think conservative estimates say 30% of individuals out there snore to some degree. More liberal estimates, 50%. I think most people will tell you after a night of heavy drinking, if I'm in a certain position, etc., I might snore. So I don't think a lot of adults escape at least occasional snoring. Now, for men, it's much more likely that we will snore versus women. I think we're twice as likely to have snoring problems than women do. And the causes are interesting. So most of us think about, we mentioned alcohol after a night of drinking. A lot of individuals will snore. Body position can certainly do it. Most adults are more likely to snore lying flat on their back than on their sides. In fact, I think a lot of people listening to this podcast have probably received the gentle elbow in the ribs from your partner telling you, hey, you're snoring. Can you please roll over onto your side? Most of us tend to snore less on our side than we do on our back, owing to the dynamics of the airway. It's much more collapsible, front to back than it is side to side. In kids, particularly kids with larger tonsils, that might not be the case. They may be more likely to snore a little bit on their sides than they are on their back. And so when we think about what is happening with snoring, it's really a fluctuation or a lack of stability in the upper airway, so that the tonsils or the tonsillar pillars, the little pieces of tissue that sort of, encompass, that sort of surround the tonsils, the tongue, parts of the nasal passage, the uvula, the little piece of flesh that hangs down in the back of your throat, all of these things vibrating tend to create snoring. And when I think about snoring, I always think about when you're using the hand dryers at an airport, or wherever there's hand dryers. I seem to encounter them most in airports, I guess. So you wash your hands and you walk over to the hair dryer. And there's this blast of air coming out of the hand dryer. And as you put your hands under it, if you sort of, kind of make a hand like you're praying and let the air go between your hands, if you slowly start to open up your hands a little bit, you'll find a space that might make your hands start to vibrate. So I don't know why I always do this, but as I wash my hands, I always do it. And as you open up your hands, it starts this, it kind of vibrates, make this vibrating sound that can be very loud. And I don't know, for years, I've always kind of done that. When you find that perfect opening, you create this sort of resonant frequency. And that's sort of what's happening with snoring, that there's a part of your airway that is lax enough. It's got enough potential for movement that as you push the air through those two, sides of tissue, you can create a vibration that is a sound. And so that's really what's happening with snoring. So when you think about things that are going to affect the airflow, or things that affect the tissue position and firmness, you're thinking about things that are going to affect snoring. So we talked about alcohol. Alcohol is a muscle relaxer. That's one way it's going to help facilitate snoring. It's also a sedative. So the things that might typically wake you up, loud snoring or breathing disturbances, this is going to facilitate your ability to sleep through it. So there's snoring and alcohol are sort of working on two fronts there. Weight's a big one. A lot of people will say, when I weigh X amount, I don't snore. But if my weight creeps up around the holidays, which it probably has for a lot of people at this time of year, I notice that, when I'm 5-10 pounds over where I want to be, I do tend to snore more. So for individuals who are struggling with snoring, one thing that you can consider, besides a surgery or something shoved into your mouth, or CPAP or something, is weight loss. A lot of times fitness, weight loss can be very helpful. So a lot of people observe sort of a dry, or as my daughter's boyfriend put it, a damp January. So I'm not going to fully stop drinking, but I'm really going to cut back. I like that term, damp. For a lot of people who observe sort of a drier January, you might find that the snoring gets a lot better. So keep that in mind. Other things, allergies. So in the fall, in the spring, here in Virginia, we have molds and pollens and things like that. So for a lot of people who are struggling with allergies, you may find snoring happens more during that time. I know I certainly do. And along that goes along with colds. We're having the big flu and COVID and RSV happening right now. So for a lot of people who are struggling with those types of things, you may see more snoring. Along with weight, we could also put in there pregnancy. Pregnancy is definitely a risk factor. There are women who tend to snore more when they're pregnant, and then they don't once they have their child. And then just sort of anatomy, the way you're built. How big are your tonsils? How is your tongue? Do you have sort of the pronounced, sort of pronated bulldog kind of jaw? or do you have more of a recessed jaw? And that can matter too, because the people who have more recessed jaws, your tongue and oral contents are kind of shoved back a little bit more and can create more of a potential for snoring. And we'll talk more about that in terms of treatments. Altitude, individuals who, moving back and forth between higher altitudes and lower altitudes may see a difference. And then just body position we've talked about. So why do we care? Well, snoring can be a marker for a condition that we've talked about already in this podcast. In episode 5, we talked about milder sleep apnea, sort of introduction to sleep apnea, but really that episode focused on mild sleep apnea. We certainly know that snoring can be a precursor for sleep apnea. So, can you snore and not have sleep apnea? Absolutely. And this is the patient that we see a lot in the clinic. Hey, I'm here because a guy comes to the clinic. He says, look, I'm here because my husband says I snore really loudly. I don't hear it. I feel pretty good, but I'm here to get that checked out. We see that quite a bit. That sort of partner telling somebody, hey, that you snore, you might want to get it checked out. That doesn't necessarily mean that you have sleep apnea. Generally, when you see sleep apnea, you're going to see snoring, but generally, when you have snoring, doesn't necessarily mean that you have sleep apnea. Keep in mind, the bar for sleep apnea is fairly low, like we talked about in episode 5. So while we certainly do sleep studies on patients who don't have sleep apnea, by the time somebody gets to our clinic, their snoring has progressed to the point where a partner's saying, look, you got to do something about it. We often do see it. What you do about it, we sort of talked about in episode 5. So sleep apnea is probably the thing that most people associate most with snoring. It's interesting because in this old article that I just read to you, it indicates marriage issues. And that is a real thing. It's been shown in research that individuals who snore loudly, it can be a problem with the marriage. And there is a term that I don't like to use. It's called sleep divorce. This idea that something is happening within sleep. Doesn't necessarily have to be snoring. It could be body movements. It could be a host of things that are creating problems with the two individuals sleeping together. Well, one individual moves to a different place. I don't like sleep divorce. I think it's sort of a negative term. It's more like, I don't know what you would call, it's like I don't know why open marriage just popped in my head, but it's like, hey, listen, we've been together in this bed. I'm going to see other beds. I'm going to beds that don't actually involve you being in them. That's it's not a divorce. It's just like a changing of the rules of the relationship. Hey, sometimes we'll sleep together, sometimes we won't. When you drink heavily, you can sleep in the guest bedroom, or I'll sleep in the guest bedroom instead of both of us being here and struggling. So somebody's got to come up with a better term for sleep divorce. I don't think it's sleep open marriage, sleep swinging, but we can do better. So if you've got any good ideas about that, DMing. So the things we hear a lot about in terms of sleep snoring risk, gastroesophageal reflux disease is another one we hear about. I wanted to feature a few others, and before I mention that, just understand that when we're talking about these things, we're talking about snoring being an independent risk factor. Now, I will grant you, it is very difficult sometimes in these population studies to segregate just snores, which we often call primary snores. Somebody who snores but doesn't have sleep apnea versus snorers who may just have sleep apnea, this has not been diagnosed yet. It's interesting in women who snore, particularly before menopause. If you're a woman who's not gone through menopause and you snore and you continue to snore for some period after menopause, that does put you at risk, according to a study, for developing diabetes. So gastroesophageal reflux disease, sleep apnea, failed marriage, diabetes, depression. In fact, snoring women who were pregnant in a 2021 study showed more depression than individuals who were pregnant who didn't snore. So mood disturbance we can put in there. And certainly it becomes very difficult to tease out depression from sleep disturbances. That's a big one. When you're tired, you often feel depressed. So Do I feel badly because I'm tired? Do I feel badly because specifically have a mood disturbance? Um, the cardiovascular risks of snoring are pretty profound. High blood pressure, hypertension, heart failure. Children who snore when they're young are at higher risk for atherosclerotic disease when they get older. And even stroke has been shown to be related to individuals who snore. So these are not harmless types of things. I found another really interesting study linking snoring to individuals with idiopathic sudden sensorineural hearing loss. So people who just sort of have spontaneous hearing loss, there seem to be individuals who are more likely to snore. And interestingly, these individuals tended to be less responsive to the treatments that you would use for that. So auditory functions in individuals who snore and have sleep apnea do tend to be less than those individuals who don't. And I have actually seen patients, and this is more anecdotal, partners of individuals who are loud snoring having problems with hearing in one ear or the other. Can you imagine being in a small bed next to somebody who snores very loudly for hours, night after night, right into your ear? It doesn't take a big jump of imagination to see how those individuals might lose some degree of auditory functioning just because you're next to that person. So we want to be very careful. I know somebody very closely who has got hearing loss in one ear to the point where she wears a hearing aid. And she says, my strategy is to aim that ear towards my partner, which I thought was very intelligent. This young woman is very smart, and she's just aiming that relatively problematic ear towards her partner and has no problem with that whatsoever. So, keeping those things in mind. The other thing that's really interesting is that a lot of individuals who have sleep apnea or snoring often have difficulties with their vision. And there is a eye doctor here in Charlottesville, Andy Collins, who said, I believe that when I do eye exams, I can see certain things in the individuals who have sleep apnea, and I use it almost to screen. So I've got this, ophthalmologist who sends me patients that he says he feels like I'm looking at their retina, I'm looking at their eyes, I'm looking at their, eyelids, and I see things that I associate with sleep apnea. And one of the things is glaucoma. And there's been some back and forth with this. There have been studies that say, no, look, there really isn't any relationship between snoring and glaucoma. But there was a recent study. It was the title of the paper, which was in the BMJ Open, was Association of Sleep Behavior and Pattern with the Risk of Glaucoma, a prospective cohort study in the UK Biobank. And in the results, it said, compared with individuals who had a healthy sleep pattern, an excess risk of any glaucoma was observed among individuals with snoring and excessive daytime sleepiness. That was a 95% confidence interval, which was really high. So I think that when we think about snoring, I think it's perfectly fine to think about the cardiovascular risks and the things of that nature that we would typically relate to snoring and potentially sleep apnea. But I think we have to go even a little bit further and understand that there may be some things associated with just snoring and health risks that we really shouldn't be ignoring. And that's really where we're at right now, I think, in general with medicine. Are we diagnosing diabetes too late? Like by the time you meet the criteria for diabetes, had you been monitoring your blood sugar level, could you have sort of, headed this off earlier and been much healthier for it? We've talked about that with a mild sleep apnea. Do we need to be treating an individual with 5 breathing problems per hour? What about less? What about 3 breathing problems per hour? Is there a long-term health benefit to doing that? Like, these are sort of unknown questions. The last one I'm going to throw out there, just because I thought it was so interesting, was a study that came out in 2022, genetic evidence supporting a causal role of snoring in erectile dysfunction. And basically said, look, people who snore have more erectile dysfunction. Now, again, you can go back to the whole, this is erection is a vascular event, right? So you can imagine that if young people who snore have more risk of atherosclerotic disease, if we know cardiovascular disease associated with snoring and sleep apnea, it doesn't take a huge stretch to understand how this might be the case, but something we all should probably think about. So how do we diagnose snoring? It's generally coming from a bed partner. I do have patients occasionally whose snoring gets so bad they'll hear it. They're watching television, they fall asleep, and just as they're sort of crossing from consciousness into unconsciousness in that light sleep, they'll hear themselves snore. Smartphones and apps can certainly do it. They kind of record you during the night. We use a lot of sleep studies. I think for individuals who just have sort of isolated snoring or isolated concerns about sleep apnea, I think a home sleep study is perfectly reasonable and can capture snoring and breathing disturbances perfectly well. And we'll talk about the diagnosis of sleep apnea in a upcoming episode. People always say, well, I don't want to do a home sleep study because they're not as accurate. I think that's true. I don't think they're quite as accurate as an in-lab study, but they're plenty accurate. It's sort of like, digital cameras. Oh, well, you've got, this 1.2 megapixel, mine is 7.8 megapixel. I'm making these numbers up. I have no idea what I'm talking about. But when you look at the camera, picture of the 1.2, you're like, this is incredible. Like, I can't really see the difference. Well, you could if you were taking pictures of people from a hot air balloon. Well, I'm not doing that. I'm just taking pictures of my kids, like playing in a soccer game or getting ready for prom or something like that. So yes, maybe this camera would be better, but for what you're using it for, it's completely irrelevant. And I think that home sleep studies are not as good as in-lab studies, but for what we're using them for, my partner makes sounds that are so loud I'm deaf in my left ear. I think the home study is perfectly appropriate. So don't be talked into the in-lab study unless you need it. We can sometimes do that. So how do we fix snoring? If you're going to fix it, I would strongly urge you to fix it rather than the noise machine or the quiet on noise suppressing earbuds or the Bose noise suppressing earbuds or the sleep divorce. I mean, there are things you can do that make it better for the partner. But I really hope that if you're listening to this and you're a snorer, or the person you care about most in the world is a snorer, or your kid is a snorer, that you don't just use something to cover up the problem, that we actually investigate it. There's a sleep specialist near you who she is ready to help you through this process in a way that could really be meaningful in terms of the change in your health. Weight loss is a big one. And I'll tell you, as somebody who's worn a CPAP in the past, I did it as sort of an experiment wearing a CPAP. That's the continuous positive airway pressure device we often use for sleep apnea. Can be used for snoring. I think it's a big hammer for a small nail, and you may struggle to get your insurance to pay for a device if you snore, but you don't have sleep apnea. And that's a whole other insurance debacle that we don't really need to get into. But for a lot of people, when they're sitting down in front of me and they're like, wow, you mean it's either surgery or a CPAP or an oral appliance? I'm going to really lose some weight. Like, now they're motivated. They weren't really motivated for the year-end resolution to hit Planet Fitness and really make some goals there. But when they're looking down the barrel of snoring treatments, a lot of times that can be really motivating, and it can be very effective. For some people, just losing a small amount of weight can make a huge difference in their snoring. So yeah, I mean, maybe you need to lose 30 pounds according to your primary care doctor. Don't underestimate the snoring improvements that can be seen when you lose 5 or 10 pounds. Now, for somebody who says, look, when I was thin, when I was heavy, it doesn't matter. I've always snored since I was a kid. That might not be a viable option, but it never hurts to try. For some people, positional therapy can be very helpful. That can be just electing to sleep on your side or using something that puts you in that position and allows you to stay there. We've talked about sewing a little pocket on the back of a shirt and putting a tennis ball there. They make shirts that kind of prevent you from rolling onto your back, or a little bumper you can wear. It kind of straps around your chest. It's a little padded bumper on your back. So when you roll to your back, that ball or that bumper makes it uncomfortable and it keeps you on your side. And I did something like that before. I went through a period where I was snoring in medical school. I wore and I would just sleep on the bumper. I was so exhausted in medical school that I would literally wake up on the tennis ball. So I just started sleeping with a backpack with a basketball in it. Like, that did the trick. And after a while of training myself, I didn't need to use it anymore. So there's all kinds of interesting things out there, including pillows that sort of put your head in a better position. So that can be sort of more of a standard pillow or more of like a foam wedge that allows you to be a bit more upright. So being more upright does help with snoring. So if you have an adjustable bed, raising the head of the bed a little bit can be very helpful. Oral appliances. I'm going to read another great passage from an historical medical text. This was from Hall's Journal of Health in 1881. The title of the article was "Why Persons Snore." And the question in the article says, how can this habit be cured? They called it a habit. And their response was, first, you must give a person a chance to breathe through the nose and then make him do so. If there are any obstructions in the nasal passage, it must be removed by treatment. Then if a snorer can't keep his mouth shut up by force of will, his jaw must be tied up. A harness for the lower jaw is sometimes employed in bad cases of snoring. A skull cap worn upon the head serves to hold a system of straps under the chin and keep the mouth shut until the patient can form a habit of sleeping on his side or with his head sufficiently elevated to hold his jaw. So even back in the day, there were sort of treatments for snoring that still exist today. Chin straps and mouth taping, all those things still exist. I would be very careful about mouth taping. I'm not a fan. I don't really understand most of what's written about mouth taping, which is kind of a big deal right now. But certainly trying to support the jaw or doing something, like a chin strap can be helpful for snoring. Now, the problem sometimes comes is that you make the snoring quiet, but you don't treat the underlying breathing problem that's there. So for instance, you can have sleep apnea, make the sound of the snoring go away, but the sleep apnea still be there, and all the health related risks that go along with it are still there. So we want to be very careful about those types of things. So oral appliances can be used. Dentists can make these things. They typically work by being put into the mouth and advancing the jaw forward, which again brings the tongue and sort of stabilizes the airway. So oral appliances can be a treatment for snoring. There are some that you can do yourself. Be very careful with those. Talk to your dentist about those because they can make your teeth move. Or your dentist can actually make one specifically for you that can be very helpful. And so again, the oral appliances can sort of range the gamut in terms of different ways that they can work. But again, mandibular advancement is the most common common way they're used right now. Surgery is another way that snoring can be treated. There was a great case study from 1852. Snoring prevented by excision of the uvula, which was a case report about a young person having his tonsils removed. Snoring went away, but then came back. And then upon further inspection, they looked back there and the uvula was very large and was, vibrating when the person snored. So they took it out. So even back in 1852, snoring was being treated by surgical methods. There are lots of ways that snoring can be treated. Tonsil removal, processes that affect the tongue, the palate, the uvula, etc. So that's something that we could talk about a whole episode about. But just, if there's something you're interested in, talking to an ENT who's well versed in surgical treatments for snoring can be very helpful. Usually a sleep study will be done ahead of time, which serves a couple of purposes. One, allows the surgeon to know whether she is treating somebody who has sleep apnea or not. There's also a lot of insurance implications, meaning that insurances will treat surgery for snoring differently in somebody who does not have sleep apnea than somebody who does. It's almost elective surgery if you don't have sleep apnea. So that sleep study can be very helpful. I will mention Inspire. That is the treatment for sleep apnea that so many people are talking about, because the ads are, to me, a little misleading that, hey, you can treat your sleep apnea without CPAP. Well, yeah, but it also involves something being surgically implanted to your neck and your chest. So this is not a little wave of the wand kind of thing here. Generally speaking, Inspire is not going to be used for primary snoring. It is a treatment specifically for certain individuals who have sleep apnea. CPAP, again, kind of the same thing. You can treat snoring with CPAP. It's just that insurances may balk at paying for the CPAP. It's a remarkably effective way to make somebody quiet. It just might be a big hammer for a small nail. But I certainly have patients who wear a CPAP solely because they don't want to snore. They don't want to disturb their partner. Humidification may be helpful. But just want to be very careful about the tapes and the things across your mouth. Nasal dilators or the breathe right strips are certainly easy things to try. Whether or not they're going to be useful or not is a completely different story. So that really wraps up what I wanted to say about snoring. Pay attention to it. It can be an indicator of sleep apnea, but even if your partner's saying, oh, look, you just snore a little bit, I never hear you stop breathing. Number one, I have a lot of people who have terrible sleep apnea whose partner swears up and down he, she, they have never heard any sort of sign of breathing disturbance. And number two, there may be intrinsic risk just with the snoring. So this is a conversation to bring up with your doctor or your sleep doctor, simply because I think addressing these types of things early can make a big difference later in somebody's life. That's it. I appreciate you listening to this very important podcast and very important topic. Share it with your mother or father who snores but refuses to do something about it. I find that threatening, hey, look, we'd love to come to the cabin or to the vacation house this summer, but until you deal with your snoring, I am not subjecting my family, because we all hear it the entire week and it ruins the vacation for everybody. So there are ways to strong arm your parents into addressing their snoring, which I think is something that is very important. So anyway, thank you very much for listening to the show. My name is Dr. Chris Winter. You can communicate with me. I'd love to hear your snore stories. If you want to record yourself or your partner snoring, I would say we could play them on a future episode. But if you listen to the episode we did on noise machines, I'm not sure that we would be able to broadcast the sound of snoring. It might just get filtered out. But love to hear your snoring stories. Successes, failures, etc. You can communicate with the show, Dr. Chris Winter on Twitter, Dr. Chris Winter Instagram, Dr. Chris Winter TikTok. Follow, like, subscribe to the show. Take a look at our YouTube channel, Sleep Unplugged, where we post all the videos of these episodes there. I've got 2 books out. Both cover snoring in great detail: The Sleep Solution, Why Your Sleep's Broken and How to Fix It, as well as The Rested Child, Why You're Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. Trucker hats, $25. DM me. We'll figure out the competition that involves the hat soon. That's it. Until next episode, sleep well.